That is so scary.
Just leave it. Just leave the cord. Stop. This is driving me crazy.
No, thank you. Hey y'all, welcome back. It's everybody's favorite time of the month, much better than that other time of the month, where we review an episode of TLC's famously entertaining Didn't Know I Was Pregnant and ruin it with educational commentary. This episode is absolutely wild. You will not believe what happens, and also I am so frustrated at the advice given to the person who called 911 regarding what they should do to help. Hopefully they have stopped giving the advice they give in that 911 call. If you're new here and you'd like to subscribe, we'd love to have you. This episode is sponsored by Soundcore. We'll hear more about them in a minute.
28-year-old Danil is a single parent of 3, ages 5, 7, and 8, balancing motherhood with her job as a manager at a fast food restaurant. Danil has a steady boyfriend.
We were together for 6-7 months. I was not trying to have another child.
So she's on birth control, in a relationship, has a job, has 3 kids that are 8, 7, and 5, and does not want another baby right now, which is completely understandable. And looks like she's consistently taking her birth control. Combined oral contraceptive pills are over 99% effective in preventing pregnancy if they are taken correctly, meaning every day, on time, within a reasonable couple of hours of that time, and you're not missing pills, throwing up pills, etc.
Danil's health clinic requires her to take monthly pregnancy tests in exchange for free birth control pills.
Okay, but you look good to go.
Thank you.
My first test was in May, and my second test was in June. Both tests were negative when I took them.
So she is getting free contraceptive pills from a clinic who has her take a pregnancy test each month when she gets them. May and June, she had negative pregnancy tests. So keep that in mind as we move forward and find out when she ends up giving birth.
My menstrual cycles were normal. My full 5 days each month.
During that time, Danil doesn't notice anything out of the ordinary.
I didn't get cramping. I never felt nauseous.
As far as any changes in Danil, maybe a little moodier.
How's that for being a bit offensive? He's like, I can't really think of anything. And she's like, yeah, no, I didn't have any symptoms at all. Everything was fine. I was still having a period, which we'll talk about in just a minute. And I felt normal. I didn't notice any changes. And her dad's like, you were moody. Oops.
That fall, Danil gains a few pounds.
Nothing noticeable. I figured it was just her working at a restaurant, just eating fast food burgers and fries.
I only gained 10 pounds. I had no cravings. I was wearing all my normal clothes. I just thought it was from stress.
After all, the mother of 3 has not noticed any swollen feet or unusual stomach movements.
No symptoms at all. That's very interesting. This might be the first episode we've watched where they didn't, in hindsight, go, actually, maybe I had this or that going on. She's like, nope, nothing was going on. With regards to having a period, you can't actually have a menstrual cycle while you are pregnant because the menstrual cycle is shedding the lining of the uterus, and that would mean the pregnancy goes with it. People can have bleeding throughout a normal pregnancy. It generally wouldn't actually be 5 days at a time every 28 days. But I guess in theory, it could be. That would be really, really odd if someone was actually tracking this bleeding and it was truly like 5 days at the same time that they would usually be menstruating. However, crazier things have happened. So it's not a menstrual cycle. It is bleeding during pregnancy. But if you don't know that you're pregnant, obviously you're going to think of it as a menstrual cycle, and you may even think it is your normal monthly cycle if you're not keeping really close tabs on it. And I guess in a very rare situation, you could even be having it at that time frame, but that would be really unusual. And the reason I say that is because the reason you have hormonal changes that correlate to your menstrual cycle is related to ovulation, and the reason your bleeding comes at a specific time frame is because of ovulation. And if you're not ovulating, which you're not while you're pregnant, it's hard for me to understand how you would actually be on a cycle that is bleeding for 5 days at a time every month. But again, I wasn't there, not my experience, and it probably doesn't matter anyway.
On the morning of December 21st, 2007, Danil begins experiencing stomach pains.
December 21st, so May and June, negative test. If she is full term, then let's look up and see how many weeks she would have been. We'll just pretend this is the start of labor. Who knows if it will be. Then if we look at May and June, she would have been 7 to 14 weeks. So that means those tests were done at a time you would definitely expect a urine pregnancy test to come back positive if she's full term right now. So if she's preterm, maybe not, but that is very unusual.
By the time Danielle gets to the restaurant that day, things take a turn for the worse.
Is she gonna have a baby at work?
I just felt like a strong cramp on my side.
Are you okay?
Call 911.
Okay.
Oh God, please hurry, please.
She thought she was on her period. She just started freaking out because there was more blood than usual. She was saying, I'm gushing blood.
That is so scary to think you're on your period, but actually it's some pregnancy complication. So what's going through my head is this just bleeding that is associated with early labor from cervical change, or is it actually an abruption where the placenta has pulled away from the wall of the uterus and the baby and the person who's pregnant is losing blood, sometimes rapidly? It's very dangerous. It can be life-threatening for both of them. Is it a placenta previa, meaning the placenta is overlying the cervix like this, which would be sometimes a reason that people have bleeding on and off throughout the whole pregnancy and is also very dangerous. And if you try to deliver vaginally through a placenta previa, there's a very high chance that the person who's pregnant is going to lose so much blood it is threatening their life, but it is almost certain that the fetus before delivery will have lost its blood flow to the point of not surviving. So that is very scary. This whole thing is very scary. And then you add on top of that the fact it's happening at work. She's in a public bathroom at a fast food restaurant that she's manager at, and her poor coworker's like, sure, yeah, I'll call 911, and no idea what's going on. They both probably think she's dying. That's terrifying.
True or false? Most doctors suggest that pregnant women sleep on their backs. The answer when we return.
Speaking of sleep, does anyone else find it challenging at times? Sleep has been incredibly difficult for me this year. And if you're anything like me and have trouble shutting down your brain at night to get some rest, you will absolutely love the sponsor of today's video and your best sleeping partner, Soundcore. Soundcore are next level sleep earbuds that help you get a better night's rest. They are super comfortable, pressureless for those of us like me who sleep on our side, and they have a 4-point noise masking system that is perfect for those of us who sleep next to people who snore. Soundcore comes with preloaded sleep sounds, but you can also curate your own sleep playlist, compose your own sleep lullabies, and even wake up to a personal alarm. I have found these incredibly helpful when I am on a long 24 or 48 hour call and trying to get some rest at the hospital, because the room that we can sleep in is right next to one of the main hospital doors, and it is never quiet. The Soundcore earbuds have been life-changing. I wish I had found them so long ago. If you'd like to try out Soundcore and support my channel in the process, you can do so by using the link in the description box down below. Thank you to Soundcore for sponsoring this video. Now, let's get back to your trivia question and see what we have to say about if pregnant people should sleep on their back.
Most doctors suggest that pregnant women sleep on their backs. The answer, false.
We generally recommend that people who are pregnant avoid sleeping on their back. And the reason for that is because as the uterus grows and gets bigger and heavier, the vessels in the back, so the aorta, which is the main artery in your body, and the inferior vena cava or IVC, which is the main vein carrying blood around your body, become compressed because the uterus is growing and it's heavier, the fetus is inside, and those vessels lay behind it, and they can have pressure put on them. And that can affect the blood flow to your brain and also to the baby. So you might have, if you've ever been pregnant, notice that if you lie on your back too long, you might get a little bit lightheaded. And that is your blood supply being reduced because that blood cannot flow as easily behind a gravid or pregnant uterus. That is the reason.
911, how can I help you? We need an ambulance. One of the ladies, she said she's having cramps and she's gushing blood. And it's just all...
The actual 911 call. That is, this is from the first season of Didn't Know I Was Pregnant, and I really feel like we've just dropped the ball on this as the seasons go through, because I love that they have the actual 911 call.
It's all over the place.
With the paramedics still minutes away, the 911 dispatcher stays on the line with Danil's 16-year-old coworker.
Is she pregnant?
Any way you can be pregnant?
No. Maybe you could be pregnant. There might be a way.
A few seconds later, her water breaks.
That's when I start getting heavier cramping, and it moved to the front of my stomach and went down. And then that's when I noticed,
Oh my God, I see the head.
his head was coming out.
Oh my God, I'm having a baby.
She's having a baby.
Could have been like 10 seconds later, she was yelling, saying that she's having a baby.
Oh my gosh. Can you imagine? This 16-year-old girl is just like, I'm just gonna go to my fast food job, get done so I can go home and hang out with my friends. And then your manager is having a baby in the bathroom. It's not funny. It's terrifying. That is so traumatizing.
It's coming.
That's the moment when I freaked out.
Please help, please hurry. Okay, we're on the way.
Danil is about to deliver her 4th child.
That 911 call is wild.
Ask her how many weeks or months pregnant she is.
Do you know how long you've been pregnant? I didn't know I was pregnant.
She doesn't know.
We kept trying to ask her no questions, but she was so shocked.
I was just shaking.
She kept saying over and over, I didn't know. I didn't think it would be true either.
Oh my God.
It felt like forever the ambulance was taking.
That is so scary. I cannot imagine. The thing with 4th babies, and anybody who's had several vaginal deliveries, they can become things that happen very quickly. Like can go from feeling fine, everything's good, to having a baby like that. So I suspect she's having what we call a precipitous labor, meaning she didn't have severe contraction pain for a prolonged period of time. She just went into labor and it progressed pretty quickly, and now she is delivering. And I can't imagine, if you didn't know you were pregnant, going through the process of like, what is happening? Oh my God, I'm dying. Oh, it's a baby. Now I'm having the baby and I'm at work. No, thank you. No, thank you.
Amazingly, without any medication, Danil vaginally delivers a silent 6-pound, 5-ounce baby boy.
I didn't want to move and then him fall because his head might have hit the floor.
The baby came out and it flew into the toilet. She wasn't too close to the toilet. We didn't hear anything, just a big plop.
That is terrifying. And this poor girl doesn't know if the baby's okay. I'm sure has never seen someone have a baby. And that can be extremely jarring, even when you are prepared for it to happen. But for it to happen like that, everyone involved, this is awful. And do you think there were customers in the restaurant like going, what's going on in there? Why is nobody here at the cash register serving my food? I just want my hamburger.
Is the baby in the toilet right now? Yes, the baby's in the toilet. Okay, tell her to pull the baby out of the toilet immediately.
Let's get the baby out.
We were all freaking out at that point, and one of the ladies that I work with had went and grabbed the baby out of the toilet. As we picked the baby up, it was just like wheezing.
What I want you to do today is gently wipe off the baby's mouth and nose.
His face and his mouth.
They're pulling that toilet tissue out, which is, notoriously awful in a public restroom at a fast food place. It's probably stick all over the baby's face as they're trying to dry him off. Oh my gosh, it's awful. And then the fact that he's in a public restroom toilet is just, oh, that's awful. All of this, I can't imagine.
Embarrassed.
Then wrap the baby in a clean, dry towel and cover the baby's head.
Cover him up. He needs to be warm. Warm him up. Use my shirt. Here, just cover him up with this. Well, give it to me. Hurry.
These actors just yelling at each other, give it to me, hurry. It's just like, I am being extremely fast.
The umbilical cord was still attached. The 911 operator had told us that we need to tie off the umbilical cord so that the baby could breathe.
That's silly. That is not true. So the umbilical cord should be the last of your concerns if somebody has just had a baby in the field, as we say, meaning not in a place where they planned on having a baby. The umbilical cord can stay attached and the baby can definitely still breathe with the umbilical cord attached. There is no harm and, quite frankly, likely benefit, especially in this situation, of keeping the cord attached. So if you ever find yourself in this position, which I hope you don't, but if you do, you don't need to worry about the umbilical cord. You don't need to worry about tying it off. It can stay. It's fine. What you do need to worry about is keeping baby warm. So skin to skin, preferably with the person who's just had the baby, if they're willing to do that, especially if the umbilical cord is still attached to the placenta and the placenta is still inside their uterus. And you can encourage it to cry and breathe, but you don't need to be worrying about the umbilical cord. There's nothing about cutting the cord that allows a baby to breathe.
Do you have a shoelace there?
We need a shoelace string.
I remember the baby was blue.
But what am I supposed to do with this? Tie it around his umbilical cord?
We had gotten a shoelace, and I was telling them where to tie it.
That actually, to me, feels way more dangerous than just leaving it, because if you don't get that tied enough and then you cut that cord, the baby can bleed out very quickly. So the reason that the cord is clamped on both sides and then cut in the middle is because the blood going into the umbilical cord to baby from the placenta, when you clamp that off, if it isn't clamped, like you just cut it, the blood goes out of baby and onto the floor. Baby can exsanguinate or bleed out extremely quickly. So I worry in this scenario, like you're telling someone to tie off this cord and then presumably cut it. What if that knot isn't tied well enough and it comes off and the baby bleeds out? Like,
Just leave it. Just leave the cord. Stop touching. Just leave it. This is driving me crazy.
In the meantime, Danil is delirious with pain and in dire need of medical attention.
I don't know what that edit was. I didn't do that. We didn't do that. That was TLC's edit. They never fail to just absolutely blow my mind with both their actors and their edits.
I felt really dizzy.
Also, their background decoration. Like, this is, remember the episode we watched where they had all the baby dolls in the background? This one is like, can you imagine they're at this person's house and they're like, all right, here's what we're going to do. Put some toys right here on your kitchen counter, rocking horses, because you know those aren't usually sitting right there. And then over on the microwave, there's a little moose or some other kind of toy and other things just plopped around. Maybe laundry baskets in the background on the kitchen counter. I don't know. Very creative. Very demure. I can't do the meme not like this, not right now. All right, this is serious. Let's listen.
Like I was gonna faint. I was losing quite a bit of blood.
There's just blood everywhere.
Even a little bit of blood where it's not supposed to be, and especially for people who aren't used to seeing blood frequently, looks like a lot. But you can lose half a liter of blood in a normal birth, and that is a lot of blood. If you just imagine dumping out, a whole bunch of water on the floor and what that looks like. But if it's blood, yeah, I'm sure that is alarming and terrifying.
The paramedics arrive just as Danil's co-workers finish tying off the umbilical cord.
When the paramedics got there, they cut the umbilical cord. One guy grabbed him up and was trying to get all the blood out of his lungs.
When they were moving her, the afterbirth came out.
Her face, did you see her face when she said the afterbirth came out? Oh my gosh. That is the look of someone who did not have any part of them that wanted to witness someone having a baby, especially not when they had not signed up for it and they just wanted to go to work as a teenager.
Paramedics had to rub my stomach because I was gushing blood.
So she said they're rubbing her stomach because she was gushing blood. That means that they are putting pressure or rubbing the top of the uterus to help it contract down. So we call that fundle rub or fundle massage. And it's something that we can do if we are trying to encourage the uterus to contract down, which is what helps stop bleeding. And it can be effective. They ideally would also be giving her some oxytocin as an injection to help with the uterus contracting down if she was actively bleeding as well.
The hospital staff assessed the newborn at 2 months premature.
I carried him 6.5 to 7 months.
Hang on. 6.5 to 7 months, that would be like 28 weeks. That's not right. You can't have a 28-weeker that weighs 6 pounds, and I could be wrong. So 2 months early would be more like 33 weeks maybe. So it's still very premature, but that's a big baby for less than 35 weeks. I'm not sure.
Danil indulged in some risky behavior over the past few months.
My friends and I, we used to go out to the clubs. We used to go dance. When I did go out, I wish I didn't drink.
We talk about this in every episode because this is always what people do. They go back through all of this time that they didn't know they were pregnant, and then they have tremendous guilt over things that they did without knowing that they were putting their baby in harm's way. It is unsafe to drink in pregnancy. We don't know what level of alcohol is safe in a pregnancy, and therefore we should just not be drinking while we're pregnant. But she didn't know, right? So this is where our typical thing comes in that we always say, you do the best you can with the information that you have. And honestly, this is so applicable in so many parts of life. I rely on that all the time when I am struggling through something.
I get a call telling me that my daughter had a baby at work in the bathroom. Left me speechless. She had hemorrhaged a lot.
I would imagine.
She was very anemic. They had to do blood transfusions.
So she had very serious bleeding. If she needed a blood transfusion, she lost a lot of blood. So when they're saying like there was so much blood, it probably was a lot of blood.
Luckily, 2 weeks after the dramatic birth, both Danielle and her son Austin are healthy enough to go home.
Is this yours?
Yeah.
Do you want to hold him?
Yeah.
Congratulations.
Thank you.
So he stayed in the hospital for 2 weeks. I don't know what gestational age he was at, but over 6 pounds, 2 weeks in the neonatal unit. I bet he was early, but not severely so. I would guess 35 weeks at least, but who knows? It's hard when they use months like they do, and I think that's normal for like the average person, but they're talking about this baby from a medical standpoint. They really should be using weeks, and we have fairly accurate ways of, or pediatricians usually do this part, of looking at a baby and its development and making a very accurate guess at its gestational age based on that. Much better guess than you can make even with like an ultrasound at that point. Like 35-week ultrasound is going to be much less accurate at predicting how far along someone is than the development of the baby when they deliver at 35 weeks. So they probably know better than a couple of months early, but who knows? But that makes the negative pregnancy test in May and June make more sense if she was a bit premature, and 6 pounds certainly can fall into prematurity category for sure. And there's crazier things than baby being over 6 pounds at 32 weeks, but it would be unusual.
How does she not know she's pregnant? I don't know. I'd be confused. It's pretty much how everybody is.
Reactions from the other family members were total shock. How could that be?
Some people ask me, how did you not know?
That's like, we do this all the time, right? Like every time we watch these, the initial like knee jerk of everybody's like, how could you not know you were pregnant? And then we watch it and I'm like, of course she didn't. She had a negative pregnancy test. She was bleeding. She had, by her own account, no symptoms at all until she had the baby. Like, I don't know. Like, usually I can go, if your period does something weird, take a pregnancy test. She said nothing was weird. Everything was normal. So I don't know. I can't. This is why I like watching the show with y'all, because I'm like, what would you have told her to do different?
How is it that Danielle tested negative on 2 pregnancy tests a few months before she gave birth? In Danielle's case, she may have taken the pregnancy tests too early.
I suspect she just wasn't pregnant, or she was very early pregnant at the time that she took the June test. Would that make sense? June to July, August, September, October, November, December. Pretend it was June 15th. So weeks from June 15th to December 21st. 27 weeks. So that would mean if she was like, I don't know, guys. I don't know. Maybe it was like June 1st. Like very early June, that would be 29 weeks. So 29 weeks from the time of that test to her delivering, which she said she had delivered premature. And that doesn't mean she was 29 weeks when she delivered. That's 29 weeks from a negative pregnancy test, which she could have already been 3 or 4 weeks pregnant. And it could be a not very sensitive test. So she could even be over 4 weeks and had very dilute urine, or they didn't watch it long enough, or the line was really faint. Any of those things could be the case and make this timeline make sense. So I'm surprised that the June test was negative, and it's possible that it wasn't negative, it just was misinterpreted, or the line was super light, or, you know, any myriad of things, but it's not impossible.
Baby Austin is healthy and thriving.
So cute. Oh my gosh. And why does the little baby actor actually look like him? What the heck? That's adorable. He's so cute. I love this part where we get to see the baby.
This experience has changed my life. I was just really proud that the baby didn't die. I felt proud of what I did.
I'm just glad he's here and he's safe. When people talk about him, it's like, oh, he's my surprise visit, but he's here and I love him.
That was so sweet. I hope that you learned something today. If you're new here and you'd like to subscribe, we would love to have you. I talk about all things periods, pregnancy, and everything in between. Hit that subscribe button. I will see you next Monday.